Let's learn about enteral and parenteral feeding today. Enteral feeding and parenteral feeding are two different methods used to provide nutrition to patients, and understanding the difference between them helps nurses choose the safest and most effective option. Enteral feeding means giving nutrition through the gastrointestinal tract, such as through a feeding tube into the stomach or intestine, and it is used when the GI tract is working properly. Parenteral feeding, on the other hand, means giving nutrition directly into the bloodstream through an IV line and is used when the GI tract is not working or cannot absorb nutrients. Enteral feeding is always preferred when possible because it keeps the gut healthy, supports digestion, and lowers the risk of infection. Whereas parenteral feeding bypasses the gut completely and is used only when enteral feeding is not possible. In the enteral feeding, nutrition is delivered through the tubes such as nasogastric tube, orogastric tube, gastrojejunostomy tube, or jejunostomy tube. It depends on how long feeding is required and the patient's risk of aspiration. In comparison, parenteral feeding requires secure venous access such as peripherally inserted central catheter, PICC line, or central venous catheter, which is known as CVC, because the nutrition solution is strong and can damage small veins. Enteral feeding formulas are selected based on the patient's calorie needs and ability to digest and absorb food. While parenteral nutrition is provided as TPN, which known as total parenteral nutrition, which supplies all nutrients through a central line, or peripheral parenteral nutrition, which is called PPN, which is given short term through a peripheral IV. From a safety perspective, enteral feeding should not be used in patients who are hemodynamically unstable or at high risk of aspiration because poor blood flow can damage the intestines and food may enter the lungs. Similarly, parenteral feeding should also be avoided in hemodynamically unstable patients because rapid fluid and blood sugar changes can worsen their condition. And it cannot be given if safe IV access is unavailable. Nursing care for enteral feeding includes monitor intake and output, checking the tube site for infection or skin breakdown, monitoring lab values, assessing gastric residuals, and recording daily weight. In comparison, nursing care for parenteral feeding focuses on monitoring intake and output, controlling infusion rate, checking blood glucose and electrolyte levels, watching for IV or solution complications, and recording daily weight. A simple rule to remember this: if your gut works, use enteral feeding. If the gut does not work, use parenteral feeding.